Hello Malaysia and welcome to another edition of Medical Today. I'm Gerard Ratnam and on today's show we'll be talking about strokes. We'll also be talking about something a lot of people don't like talking about or find uncomfortable talking about. We'll be talking about mental health shortly. But for now what we want to do is delve into advertising or advertisements of medical products. And joining me in the studio is Yusni Rizal Dato Khairul Anwar. He's the General Manager for Compliance at Pharmaniaga Berhad. Well, thank you very much, Yusni, for joining us. It's a pleasure to have you here.
Thank you.
There's so many things happening on the show, so we're going to start it off with you. And of course, when you talk about products or advertising, this has become another topic of discussion within the country. And what happens is when we discuss about these things, we are always baffled about the amount of wrong or fake advertising that's coming out. So what is your opinion on the proper or the right way to advertise products?
Okay, basically in terms of advertisement, it's very broad. Okay, advertisement it doesn't come with any paper form. It comes through verbal or even material. In any kind of material comes with advertisement. So it should be, bear in mind that it should be highly regulated in terms of whatever is going to be advertised on those papers. So, from my opinion, there should be a proper regulation and control, and this regulation should be controlled by a proper body in Malaysia. So, whatever has been endorsed and approved by this body, those are the things that's approved to be advertised.
Now, when you highlight things that are wrong and right, sometimes it goes unnoticed. So I think what we want to do now is take a look at some samples and maybe you can highlight what's wrong and right. So we'll start with this one.
Okay. For me, you can see that this is a very beautiful and very attractive advertisement, you can see. But bear in mind, be careful, okay? Be careful because it looks beautiful, because it has to be beautiful and attractive for people who doesn't understand the content of the advertisement. For instance, as you can see, first is the wording, the words. You can see here, miracle.
Right.
Okay. Miracle is a superlative word. It's attractive, very attractive.
Miracle
word.
is
miracle,
superlative.
You can't have that in an advertisement. Okay.
Right.
Besides that, you can see the product itself. It doesn't have MAL. So to be advertised, the product must have MAL. MAL stands is for the product to say the product is registered by the authority body. Okay, so it doesn't have an MAL, so it means that this product is not a registered product. The second thing, and the other thing is that the claim that they have here, they have so much of claims here that is impossible, because in the guidelines say that you cannot have 20 diseases to be claimed.
Right. Okay. So there's no miracle drug.
Yeah, there's no miracle.
No, we're hoping for a miracle drug.
So, there's the other claims, and obviously you can see what covered the overall advertisement of this is that it doesn't have the KKLIU.
Right.
So that's why I was saying just now that you must have the approval, the KKLIU approval, then only you can say the advertisement is approved. So from that, again, those are the things that...
So the red flags are miracle,
yes.
Can cure you from all diseases or can cure you.
Relative,
yeah, but this usually happens with non-communicable diseases like, say, diabetes. They say, oh, this can reverse diabetes. You never know what that means.
Yes, exactly,
So are these all that need to be covered with regards to things you need to look out for, red flags?
Well, yeah, I mean, this is the only part of it. But you want to go detail of what is allowed to be inside the advertisement is that you can... There's a guide for this actually through the Ministry of Health website, www.pharmacy.gov.my. So from there, from the website, there's a guideline to say that what are the things that you're allowed to have to be approved as an advertisement.
Now let's just take a look at this one. So this one is pretty much the way you want to go with apparently advertising. So can you walk us through what you see here as someone who specializes in this?
This is called advertisement. Okay, why is that? First, it has everything as what is needed based on the guideline. So it mentions here is that ini iklan produk ubat. This is a medicine product advertisement.
Right. So you need to look for the fine print. That's what you're looking for.
And you can see the claims are not that so much like no superlative words here. You can see that. And obviously we have the ML number showing that this product is a registered product with the KKM.
Right.
And it's overall again that it has the KKLU down here. You can see the KKLU.
KKLU.
So it means that it's approved.
Yeah, so that's what you're looking for.
Yeah,
So
yes.
this would be a good example of good advertisement for medical products.
Exactly,
yeah.
yes,
So
yes.
moving away from this, these are some of the examples.
Yeah.
I'm sure there's more, because it's just not advertisements. People come up with write-ups too.
Exactly,
And
yeah.
when you look at the write-up usually, what are the things you want to look out for in a write-up?
Write-ups means depends. If you come to advertisement again, saying that you have to see the content of the write-up, the source, those kind of things.
Right.
And again, that if you want to see the write-up approved, again, it always goes back to the KKLIU.
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 So KKLIU is what you're looking for
yes.
in a write-up or in an advertisement like this. So this is a good advertisement,
exactly.
and this is not so good. So
yeah.
basically, the telltale signs would be miracle cure, miracle can cure you. These are red flags that stand out. So you need to look out for these things with regards to advertising. Now,
yes.
in short, what can be advertised?
Again, okay, that's a very good question. Because, again, that things that can be advertised, again, you have to go back to the guide, obviously. Okay, there always being a guide to guide us. But in short, for people out there to know, a simple way to know that first, the product has to be a registered product.
Okay, so registered product, that's most important.
Then it must be approved by the Medicine Advertisement Board, MAB Board. Okay, that is where the MO is based in the MOH.
Right.
And no factual claims, and it's OTC product, over-the-counter products.
So OTC means over-the-counter,
product.
OTC product. So
yes.
these are the 4 things you want to look out for. Registered product, approved by MAB. It has factual claims.
Yes.
And over and above that, it has to be an over-the-counter product.
Yes.
So these are the basic rules you need to look into.
Yes.
So when you talk about these things, what types of products can't be advertised?
Okay.
It sounds like a tough question then.
Yeah, it's tough, but I mean, thanks for the question, Gerard, because I mean, everyone's fair to know this, because like for the poison products, the prescription product, those products cannot be advertised clearly. But it can be directly to the professionals. Okay, the doctors, yes, it can be advertised directly to the professionals. But for the public, those are the products that you cannot, widely advertising that is good for what kind of diseases to be cured for.
Very quickly, how do we as consumers verify or go on to check if the product or the advertisement is genuine? Of course, KKLIU is the acronym you want to remember at all times. It has to be there. What else?
Okay, the other way that you want to see, you want to check whether the advertisement is valid or not, is you can go to you must go back to who's regulating this. Is the Pharmacy Enforcement Headquarters, PJ, and they also have the state state pharmacy in overall Malaysia. Okay, and this is where the MAB is. Okay, MAB will be in PJ, and the state enforcement will have the enforcement to go against the wrong, the practices.
Right.
And you can go to the website. www.pharmacy.gov.my.
Well, let's talk about brochures and pamphlets on products that are being circulated all the time. Are there any regulations that need to be followed with regards to this?
The same. It has to go to the same regulation as I mentioned just now. So it has to have KKLIU, and the validity will be 3 years. So that's the same as how the other advertisement is. Yeah.
Now, in Malaysia, what needs to happen is we always need to look for a regulator. Now, who in Malaysia acts as the regulators for advertisements?
Is the pharmacy enforcement. Okay, the pharmacy enforcement I was saying just now in PJ, and they have all the branches in all the states in Malaysia. They are the one who will be regulating and going after all these wrongdoing things. Yes.
So
and we also need the public to complain, to help them to go enforce against the wrongdoing of the advertisement.
So public can put out complaints.
Exactly, yes. They have the right.
Yeah, you have the right to put out complaints if you see something wrong. So remember that advertising is a big part of your everyday life. It's a big part of your medical health. And that is something you have to look into, especially if you're buying products for yourself, for your family.
Yeah.
I mean, it was great of you to take time off to come and join us here on Medical Today. We hope to have you back here again to talk to us about these things, especially what's fake and what's not with regards to advertising. We just spoke to Yusni Rizal Dato Khairul Anwar, the General Manager for Compliance, Pharmaniaga Berhad, right here on Medical Today, BNC.
The Nation, a talk show from the Current Affairs desk with in-depth conversations on health, women, property, culture and performing arts. Only on the Nama News Channel.
Listen to views of industry captains. Analyze and examine trends and projections. Gain market insights from subject matter experts. Biz Talk every Friday only on BNC.
Brings you the latest in current affairs, lifestyle and entertainment, as well as one-on-one discussions with fascinating personalities. Only on Onama News Channel.
Hello and welcome back to Medical Today. I'm Gerard Ratnam and I do hope you're having a lovely Saturday wherever you are. Well, on the show we did cover a little bit about advertising a while ago. From there we want to move into diseases and we want to talk about a disease that does not discriminate. It's no longer for the old, everyone gets it. It's a stroke and everyone's heard about a stroke or know of someone who has a stroke, but what actually is a stroke? The details of it. We'll give you some insights as we move along. Joining me in the studio is Dr. Ramesh Narendiranathan, a consultant neurosurgeon from Ramsay, Sime, Darby Healthcare. Doc, very good day and thank you very much for joining us on Medical Day. It's good to have you here.
It's my pleasure being here.
Well,
thanks for calling me.
When we talk about strokes, like I said earlier, it doesn't discriminate. What's your, if you want to give us a brief overview on this, where would you start?
All right. Strokes traditionally have been accepted as a disease of the age. Aging blood vessels, the medical conditions or the non-communicable diseases, heart, blood pressure and diabetes that comes with it. But there's another group of patients who actually present with strokes at a much younger age. It can be as young as a child to under 50. In fact, the age between 35 to about 50 has got a risk of stroke.
Now, let's very quickly move into the causes of the stroke because there's just so much to cover when it comes to the stroke. And we've got 3 different areas we want to try to cover today. So we'll start with the causes of the stroke in the young. Give us your thoughts about this and what are the causes?
All right. The causes of strokes in the young are aneurysm, brain aneurysm, brain arteriovenous malformations, cavernomas, moya-moya disease, and there are many other small vascular abnormalities. All these are due to vascular abnormalities, blood vessels in the brain having some abnormality which ruptures and causes a stroke.
Now, when you look at the stroke, the most common causes of a stroke, let's walk into that area now. What are the most common causes? As a doctor who's been practicing for many years, and I'm sure you've done your own research, what would you think is the most common
The most common that we see in the younger age group is actually an aneurysm. A rupture of an aneurysm which causes a stroke.
Right. So if you're going to expand and explain to us what an aneurysm is, what would that be?
All right. An aneurysm, is how I put it to my patients sometimes, is like a balloon. It's a bulge from the blood vessel. It bulges out like a balloon, and as the balloon grows bigger, the walls become thinner, and it suddenly ruptures into the brain, causing severe headache or stroke.
So the symptoms can be severe headaches, but there's an aneurysm, but there's also an arteriovenous malformation now, or an AVM.
Yes.
Yeah, so what's the difference? Can you differentiate between these two?
Right. An arteriovenous malformation is a tangle of vessels between the inflow of blood into the brain and the outflow of blood from the brain. Again, to put it in layman's terms, is like your highways. From your major highway, you have your trunk roads to your town roads and right down to your village roads. And the blood returns the same from the small vessels right up to the major vessels. Now, if there's a shortcut between the major vessel and a major outflow vessel, then there's a high blood flow in the outflow vessel. And this potentiates the risk to rupture and cause a stroke.
Now, the risk factors for an aneurysm, maybe you can walk us through the risk factors.
The risk factors commonly is smoking, high blood pressure.
All the things we like to do, huh?
Yes. Family history, okay. The age over 40, so in that 40 to 50 has a slightly higher risk of for having an aneurysm. Unfortunately, women are more prone to having an aneurysm as well. The ratio is about 3 to 2.
In the same age group, 40 to 50?
Yes.
Yeah, and this is because of unhealthy choices in lifestyles?
No.
Yes and no?
No. In the younger age group, it's a bit too early to see the effects of the unhealthy lifestyle. Unhealthy lifestyle for a long period of time is going to cause you problems as you age. So in this younger age group, it's not a healthy lifestyle. It's going to be difficult to prevent this, okay? Except maybe drug use, which is another risk of having an aneurysm. That's the only thing that is probably preventable, and of course smoking. Right.
So if we're going to lay out the risk factors very simply, the risk factors once again would be smoking and high blood pressure, of course. That's sometimes uncontrollable with the working lives we lead. You know, some of us are very stressed. Now, let's talk about the preventable measures with regards to aneurysm and AVMs.
Unfortunately, this blood vessel malformations, except for aneurysm, which has got some factors, AVM, we still do not know what causes them. Cavernomas, we do not know what causes them. So it's going to be quite difficult to prevent them.
Right.
The only thing I can say is the moment you start having symptoms or early signs, get to see your doctor immediately.
Now we need to move a little quicker and talk about the symptoms or presentations with regards to these problems. You know, what are the symptoms? What will you feel when these things occur to you? Okay,
aneurysm classically presents with a sudden onset of severe headache. I usually ask my patients, because everybody experiences a headache now and then, and I usually ask my patient, is this the worst headache in your life? And this is actually a standard cliche for us to diagnose that this patient has had a potential rupture aneurysm. Other milder, not so common symptoms that we see is sometimes you can have pain at the back of the eye. You can have a drooping of the eyelid, what we call ptosis.
Right.
Okay. What sometimes people call lazy eye may actually be suggesting of an impending rupture of an aneurysm.
Right.
Okay, neck pain.
Once not a rupture, but an impending rupture.
Impending rupture.
Now, okay, with that, we also need to look at how quickly we can diagnose and what kind of diagnosis.
Right. The moment the patient comes into the hospital, we suspect it's a ruptured aneurysm, the first thing done is a CT scan of the brain. A CT scan will show us the hemorrhage within the fissures of the brain. Once that is done, once we are aware of that, then we need to confirm that the aneurysm and where is the location of the aneurysm. Now that is usually done by, classically by the conventional angiogram, where a catheter is inserted into the artery, a small tube is put up to your brain, and dye is injected and pictures are taken. Now we have more modern techniques, what we call a CT angiogram, just like going for a CT scan. Nothing invasive, nothing going inside your body, except the contrast is injected.
Right.
and a picture is taken which can actually show us a three-dimensional view of the aneurysm with relation to its parent blood vessel. So actually gives us an idea how to treat the aneurysm.
Right. So, but if you're speaking of the gold standard of diagnosing, which treatment would it be?
The gold standard has still been angiogram. So if our CT angiogram is negative, then we will have to do a conventional angiogram for the patient.
So once someone is diagnosed or it's been ascertained that someone has these problems or has a stroke, what is the treatment that can be provided straight away?
Right. So now to treat the aneurysm, the first thing we need to do is to secure the aneurysm because of the risk of re-rupture. Right. So there are two options. One is what we call a less invasive method, that's using the angiogram again, just like how in heart surgery they do ballooning and stenting of the heart blood vessels. Here, using this fine microcatheters, you actually put coils into the aneurysm, so the aneurysm thromboses off.
Right.
Okay. The other option actually is standard age-old this thing of microsurgery, where we go in, identify the aneurysm, and actually put a clip across the neck of the aneurysm.
Right. But with these things, there are pros and cons. What are the pros and cons?
Right. For this coiling of the aneurysm, as we call it, using the angiogram catheter, if the aneurysm is of a wide neck, then the risk of the coils not sitting inside the aneurysm well is one risk. The other thing is can be location of the aneurysm. Like we know an ACOM aneurysm, if it's projecting, that's in the front of the brain, if it's projecting anteriorly and superiorly, up and forwards, they do better with surgery. Whereas if they're projecting backwards and downwards, they do better with coiling. So based on these features of the aneurysm, we actually decide whether coiling is more suitable or open surgery is more suitable. So
this also goes back to the surgeon's experience and what he thinks needs to be done. His advice is very important.
Yes, his advice is important, but unfortunately our population, a lot of them are afraid of brain surgery, and everybody wants a minimally invasive route, which sometimes doesn't help them in the long term.
Right, right. Now, just a quick question about a complex or giant aneurysm, which differs from what we're talking about. So there's something bigger to deal with.
Yeah, and aneurysm classically, of course, there's also the ones that we call an unruptured aneurysm. So any aneurysm which is less than 6 millimeters in size, I don't actually offer treatment. Because the studies have shown that their risk of rupture is low. So anything more than that is, we need to treat them. Or if it ruptures, they must be treated. The giant aneurysms, actually, those are more than 2.5 centimeters. Now, interestingly, we have tried with coil embolization and failed and had to go for bypass surgery. So some of them I actually have chosen to do a bypass surgery where I close off the blood vessel with the aneurysm because it's too big to be clipped without blocking the blood flow, and then bring in a bypass from a blood vessel outside of the skull into the brain to supply the brain.
Now, when you talk about bypass surgeries, it starts, when you have to talk about it, it starts to worry people. What's your advice with regards to bypass surgeries? You know, should it be done? Should it not be done? What's the word out there with regards to bypass surgery?
Right. This is actually going to be depending on the case-by-case basis, depending on the disease they have and what are the best treatment options available. Right. I've had one patient who had a giant aneurysm in the intracranial artery, or the ICA as we call it, and he refused surgery. He insisted on trying the coiling, so it was coiled. In the first year after that, it was coiled very well. If we look at the post-angiogram pictures, it's perfect. A year after that, it reopened. So this is where sometimes coiling is not suitable. So then we had no choice. We had to put in a bypass, get the blood flowing to the distal part of his brain, and then close off the primary blood vessel which had the large aneurysm.
Now that we're running out of time, very quickly, your advice to all of us with regards to aneurysms, strokes, so on and so forth.
The moment you have a problem, if you have a headache or you have recent onset of headaches, get to see the doctor as soon as possible. If you're one of those with frequent headaches, it's best to get a scan or an MRI of the brain done at least once in your lifetime.
So the final word is to get a scan done if you have frequent headaches. Don't leave it be.
Yes. And if you have sudden severe headache, rush to see a doctor immediately.
Right. On the note, Dr. Ramesh, it was a pleasure and an honor having you here on the show. We do hope to have you back again to bring us more about strokes and different diseases that are in that same stable which needs to be talked about. We just spoke to Dr. Ramesh Narendranathan, consultant neurosurgeon from Ramsay Sime Darby Healthcare. Thank you very much for staying with us right here on Medical Day. We'll be back just after a break. Stay with us.
Nine-11 menampilkan pelbagai segmen menarik khas buat anda. Saksikan 9-11 setiap Isnin hingga Jumaat 9 pagi. Hanya di Bernama News Channel.
Gain insights from the people with the capacity to translate vision into reality. Interviews with corporate leaders at 8:30 p.m. Monday, only on BNC.
Brings you the latest in current affairs, lifestyle and entertainment, as well as one-on-one discussions with fascinating personalities. Only on Bernama News Channel.
Hello and welcome back to Medical Today. I'm Gerard Ratnam. Now what we want to do is move into mental health. You know how people talk about their lives living in urban parts of Malaysia and not having time to sit down and relax and clear the mind. That's being talked about a lot. A lot of people are taking up yoga, meditation, so on and so forth. Apparently this is good for mental health. And this is something that is also being pushed upon and stressed on in Malaysia as we become more urbanized. And to join us right now on Medical Today is Dr. Andrew Mohanraj, who is the president of the Malaysian Mental Health Association. Doctor, it is a pleasure and an honor to have you here in the studio. Well, there's just so much to talk about when it comes to mental health. Now, within the association in Malaysia, can you take people seriously? Do they all have mental health issues? It's a tough one.
Yeah, it's a tough one.
Yeah, but tell us about the mental health status in the country. What are your aspirations as the president of the Mental Health Association of Malaysia?
Thank you, Gerard, for having me back here, actually. Well, the 2016 National Morbidity Survey indicated that 29.9% of Malaysians had, or the prevalence of Malaysians having a psychiatric morbidity was 29.9%. This is a threefold increase from a study, a similar study that was done 10 years prior to that, which showed a prevalence of 10.7%. So clearly there's a lot of work that needs to be done here. In addition to that, we also see depression taking over as the world's #1 cause for disability worldwide by the year 2030, by the year 2020, in the developed world, we would see depression overtaking cardiovascular diseases as the world's #1 cause for disabilities. Our new Minister of Health, Dr. Zulkifli, has indicated his concern about workplace stress. In addition to that, Dr. Zulkifli also had mentioned that he would like to see the creation of a health advisory council where the private sector and the public sector would work hand in hand. So in this regard, as the President of Malaysian Mental Health Association, I would like to urge the Honourable Minister to seriously consider the participation of the NGO sector as well in this council, because clearly the NGO sector has got an important role to play, not only in the provision of services, but also in terms of prevention, creating awareness and advocacy in mental health.
Hold that thought. We're going to take a look at a video and come back and discuss mental health problems within Malaysia. Let's take a look at this video.
Well, you see, working is also therapeutic. It's like a hobby. Once you pick up a hobby, you don't want to let it go. So there is so much to learn. Throughout your life, you're also learning, and it never stops. That process never stops.
I'm working because I need to keep myself occupied and also to keep myself alert in news. Okay, I'm active in news. It keeps me occupied.
I like the working life because I remember I was like 1 year staying at home, but not that I was doing nothing. I was involved in a book project for 1 year. After that, the project, I completed the project, and after that I thought I had I didn't have anything to do, so I was bored. So I might as well come back to work.
So there you have it, some people weighing in on what to do post-retirement, and that's exactly what we're talking about with Dr. Andrew Mohan Raj, who is the President of the Malaysian Mental Health Association. Now, with regards to post-retirement, you know, everyone goes to a reality check at some point in their lives, and I'm sure they've had it related to you because you always talk to people about this to get your data. Now, what are people talking to you about post-retirement?
Well, post-retirement itself is a significant life event, and in which a person has to look at a new role for himself or herself, which is characterized by loneliness, by boredom, the feeling that people are looking at you as though that you're unwanted or worthless. So this can be very traumatic, and one really has to be prepared for this. Some people are more prepared to face retirement and the consequences of retirement.
So you say some people are prepared, which means that some people aren't.
Yes.
What is the difference you see between the people who are prepared and the people who are not? What are they prepared? What have they prepped in their lives to get to that point?
Certainly, I mean, retirement would have, you need, financial preparation for retirement. In addition to that also, in order to actually enjoy retirement life, one has to plan as to how one can accommodate into this new role or embrace this new role after retirement. Some people are able to cope with it much more, whereas other people, particularly those who have held very high positions in the public sector or the corporate sector or even in the public domain.
Moving out of that limelight.
Yes, exactly, moving out of the limelight, because loss of status is really something that troubles people after retirement. I would say that even more than financial loss. So people who can handle that loss of status might do better after retirement compared to others who can't.
So let's just call it post-retirement blues.
Yes.
Now, with post-retirement blues, what should I look out for in myself? Saying I'm going to be retiring in the next 6 months or so, saying for the sake of an argument, not that I am, but if I am, what are the telltale signs that I'm suffering from the post-retirement blues.
Yes. As I said, post-retirement itself can be, or retirement is a very traumatic event. Most people bounce out of it in the sense that initially there's some difficulty in adjusting to retirement. You're quite at a loss as to what to do. Particularly if you're a senior civil servant, you might get ready and try, get ready to go to work only to discover that your personal driver in the car has been withdrawn, for example. Right. This sort of thing.
It's traumatizing.
Yes,
huh?
it is.
No driver.
Very really. For some people. But they bounce back. But the fact remains that there are some people who don't bounce back.
Right.
The psychological situation actually deteriorates to a certain point that they have features of depression. So what are the symptoms that we are looking out for, really? It's a persistent low mood or the loss of interest in pleasurable activities in life. For example, a person might watch or does not fail to watch the Bernama 8 o'clock news, but suddenly that person is no longer interested in watching the news.
Right.
So those can be the cardinal features of it. And of course, there are other features like irritability, loss of weight, loss of appetite, feeling of guilt. And this can sometimes assume very severe proportions as well.
It's interesting how I already have it, but that aside, now post-retirement is different for men and women, and I know you have an example for us, so would you like to give us a couple of examples here?
Yeah, well, I must say there is a big difference, and there are studies to support this argument as well. Women generally handle post-retirement much better, because women, as however high a position they may occupy in the corporate sector, in the public sphere, public domain, they also know how to balance this by being caring for the family, cooking for the family.
Somehow they find that equilibrium
exactly.
that's needed in life.
Whereas in men, they tend to take the identity of their job, of the position that they hold. So they might be, the KSU or the Director General or the Minister, but at home they are also the Director General, the KSU and the Minister, as opposed to a lady. So that is the difference. And a clear example of this is perhaps our very own Tan Sri Rafida Aziz. And she she has said publicly that even during her height of public service as a minister of an important portfolio, I think she held the international trade ministry, and even at that time, she found time to go back home and cook for the family and made sure they all ate together.
So she kind of kept herself busy all the time.
Yes, exactly. And that's why she was all smiles after retirement. And even now, probably...
So don't you think that the crux of the problem here is learning how to keep yourself occupied all the time?
Exactly. And that's really important, because there are various spheres that you have to look into. I mean, the three main domains that I would say is your physical, your mental, and your social domain. You need to be active both physically, mentally, and socially in order to appreciate and enjoy your retirement. And of course, as I mentioned earlier, you need to carve out a new role for yourself. And that role may be something that may be quite different from what you had done previously. For example, if you wanted to sign up for a PhD course, probably that's the best time to do that.
But a lot of people say, in order to move on, you talked about physical, mental, and the last one was physical, social. These three areas need to be covered. But before we end, very quickly, for those of us who have a lot of resentment in our lives, they say bringing resentment forward in different areas of your life will slow you down or will drag you down. What's your advice with regards to this, just before we close?
Resentment into the retirement life, or for example, someone who has been, facing retirement or made to retire. Is that what you're?
Yes.
Yeah, yeah. So I mean, obviously, there's a lot of. There could be some resentment, and
because they say you have to let go as you go.
Exactly. Yeah. So I think that is one has to let go, and one has to look back at one's experience, whether it's the good, the bad, or the ugly, that needs to be brought forward and started off with in a clean slate, and carving out a new role for ourselves and moving forward. Because whatever experience that one might have, whether it's the good, the bad, or the ugly, certainly can be lessons for our future, a future that can be
So if
useful
there is
for
one lesson you can teach us today with regards to letting go, what's the simplest way of letting go?
Well, it is to accept, and to acknowledge what has been done, and then being honest about it and to move on.
Right. On that note, we'd like to thank Dr. Andrew Mohan Raj, who is the president of the Malaysian Mental Health Association. Thank you very much for joining us on the show.
Thank you for having me.
It was a pleasure and an honor having you here. Stay with us right here on Medical Today. We'll take a short break and come back with more advice for you right here on the Bernama News channel.
Gain insights from the people with the capacity to translate vision into reality. Interviews with corporate leaders at 8:30 p.m. Monday, only on BNC.
The Nation, a talk show from the current affairs desk with in-depth conversations on health, women, property, culture and performing arts. Only on the Bernama News channel.
Brings you the latest in current affairs, lifestyle and entertainment, as well as one-on-one discussions with fascinating personalities. Only on Bernama News channel.
Hello and welcome back to Medical Today. I'm Gerard Ratnam, and in the final segment of Medical Today, we're joined by Dr. Andrew Mohan Raj, the president of the Malaysian Mental Health Association, and a TV staple right here on BNC, Dr. Alice Pratima, who always is on Bernama Today. Thank you very much for joining us. Well, what we want to talk about right now is aging gracefully, post-retirement blues, and of course, the new retirement age, which is 92, going on 93. So where do we start with it? Maybe Dr. Alice, you can weigh in on, let's talk about Tun Mahathir now. Everyone's talking about him and how he's so fit at this point. What are your thoughts on how he leads his life?
I think he's a role model. He's done it beautifully. He has done some amount of, I'm sure, some preventive healthcare, good lifestyle, and he's also kept his physical and mental well-being very well. I think mental exercises are so important to keep your mind agile. And I think he's one of those few people we can look up to see how we should lead our life in the later years.
Dr. Andrew, what's your thoughts on that?
I quite agree. And in addition to the physical and the mental components or domains, I think Tun Mahathir has also focused on the being socially active. And all these three domains are very clearly very important in enjoying the retirement life. And while Tun Mahathir when he had stepped down as Prime Minister, clearly had focused on all these components as well. And in terms of his food intake, he has been very moderate in his food intake, having nutritious food, yet very moderately. He speaks about his late mother, who always mentioned that one should not eat too much, however tasty the food may be. Things like that. So
and physical activity, I think that is so important. And keeping yourself connected.
This is where they start to take over the show. This is where they start taking over. So physical activity.
Physical activity and also being connected to the society. I think that is so important as well after the retirement years, because and that is
but that
means
also,
you never retire.
Right. Okay, but you also have to take into consideration the life he's had. He's always been in the limelight. He's always lived well. You know, I mean, after becoming Prime Minister for 20 years, he's had a good life. Not many of us will retire and have that good life. So, you know, you talked about financial well-being. Now, this is important. You need to plan for your retirement. What are your thoughts on that, Dr. Alice?
I think it's very possible to do what Tun Mahathir has done, but we have to do a lot of things, because Malaysia, we are going to become we are now an aging nation, and we will be an aged nation by year 2020 or 25. Right. And we are going to jump up exponentially. We are going to go 15% up. And we are going to have, our life expectancy has also gone up from 65.
But I'm sure his association would have taken care of that already. Malaysian mental health.
No, we are talking about everything, about the health as well. And so, of course, keeping in bay non-communicable diseases, that is so important, because that is putting a big toll on a lot of people. But here's the thing, no, do people take use, you know, you're a wellness physician, and your role in everyday life is very important, but are people taking a wellness physician's advice seriously these days? Yes, they want to, because many of them, especially the younger ones, they would still want to not go into taking medications as much, because maybe compared to 20 years back, now there's a lot of preventative methods of dealing with non-communicable diseases, and people would rather do those things than become sick, and it's difficult to fix a broken body or a broken mind. So if we keep continuing to do that, I think people after retirement can actually provide, even to the fiscal side of it, they can provide well, and the burden on the nation should be much, much lesser. Of course, individual problems, like after retirement, we know that substance abuse, suicide, marital problems, all of these things
He's sitting in the middle and keeping quiet. He's going to be talking about substance abuse shortly, because he's gone...
Oh, I'm sorry.
Not at all, but I quite agree with you. But I think central to this is really discipline. Now, a lot of people, after Tun Mahathir became Prime Minister at 92, I think this has given rise to a great deal of change in the mindset, a sort of a rejuvenation. And people who are in the retired age are also thinking that they can actually contribute a lot in society as well. If you have a 92-year-old Prime Minister, why not myself at 70 or 80
but I don't think it is as simple as that. Basically, because we do not know, research shows that we do not know whether retirement causes more health problems, or health problem causes all the problems that happen.
We're starting a little debate here, and I kind of like it. You see, as a psychiatric specialist, what you say sometimes is what they don't say, or what they say is what you don't prescribe. So it's a bit different, the modalities of treatment that come in. Is there a meeting point for your modalities of treatment? Like, say, wellness, saying if someone is having depression, put them on an SSRI, put them on something to relax themselves. But, when you go to a wellness physician, the wellness physician usually says you need to work out of that and try to look at a healthy lifestyle. Does it actually work?
I think that the mind-body connection is very strong.
He's got something to say.
But at the same time, as I said, it also involves a great deal of discipline and coming into terms with our own capacity to do things. And clearly, if we are unable to fit into a new role, when we're talking about post-retirement blues, then this can actually result in depression.
Yes.
And
many people now, they are saying, Tun is able to do it at age 92. Why can't I? But that preventive aspect should start sometime, maybe yesterday. You have to be physically capable to be able to jump right back into the mainstream of things and be able to do it. If not, they can, like you said, go into depression, or even physical disorders can happen.
That's why, again, I come back to this issue of discipline in looking at the three domains of physical health, mental health, and social connectivity. You know, I mean, as far as discipline is concerned, clearly...
See, I'm getting ready some social connectivity, which I'm going to be handing out shortly. But yeah, as you were saying.
So, you know, we're talking about discipline here. And I read somewhere that even, you know, Tun Mahathir's horses are disciplined in the sense that they have learned or they've been taught to ride slower. To accommodate Tun.
Right.
Now, so clearly there's a lot of discipline going on in Sri Kambangan.
Oh, okay.
You know,
I think discipline and know-how is important. I believe that knowledge is key. And I'm glad we are sitting here talking about it this day. And actually it's important to know how and then to do the correct things. And I think these people, if they are older and they're not yet ready, they can be retrained.
Of course.
They can put themselves into something much more flexible and they'll be able to do it. I think why not?
Right. For you at this point, Doc, you know, everyone keeps saying that you look younger and younger all the time. What is your secret to this success?
Because what
are you doing that I'm not doing right?
I have discipline that I was talking about. I definitely have discipline. I'm a disciplined person. And the other thing is you have to keep your mind active. This is where the mind-body connection comes in. The minute you stop learning is the minute you stop growing. And when you stop growing, there's no plateau in the human body or mind. You just decline.
I agree.
Yeah, so basically that is my secret. I continue to learn. I never think that what I learned or what I know, I'm a practitioner for 35 years now, but it is not enough for me. I still learn, I still teach. When I teach, I'm humbled, I learn more. Just only by teaching, I learn more.
Before we sign out, let me just tell you that if you have a question or if you just send us your details, just log on to ask@medicaltoday.com. That's ask@medicaltoday.com. And you will definitely receive a bottle of this. We'll send you one of these bottles, Citrex, a whole range of multivites by Pharmaniaga. So all you need to do is log into ask@medicaltoday.com and receive a bottle of vitamins from Pharmaniaga. Maybe just say hello and we'll be more than happy to furnish you with a bottle of vitamins courtesy of Pharmaniaga right here on Medical Today. Now, before we close, and I know we need a 2.5 hour segment for the two of you because you have a lot of good advice to dispense. We'll start with you, Dato. Maybe you can walk us through some secrets as to how you work into your daily life, some discipline action to, of course, work towards a better future with regards to aging gracefully.
Yes.
Or becoming more mature.
Certainly, as I said, that retirement actually means it's a beginning of a completely new phase in life, and often it can be characterized by boredom, loneliness, or sometimes even getting the impression that one is unwanted and useless. But retirement can also be something to look forward to. I would advise people to retire into something rather than retiring from something. And there are so many
into something, then from something.
And really it can be as exciting as the time that they were working, in the sense that if they're able to carve out a role for themselves, one can do so many things at the retirement phase that one couldn't possibly do during the working life. That could include taking up a new course, doing a PhD,
just doing something,
keeping.
Don't retire from, but retire into. Dr. Ellis?
I think
and we've got about 40 seconds to go.
The lack of purpose is the most difficult thing. I think people find it when they sit at home and think, what am I going to do for today? I think then I do agree that you need to be involved. I think charitable causes are good things you already are talented in and you did as a job. You could do it on a part-time basis. If you really feel that you can go back to work, please, by all means. I want all the companies to accept these people if they are, trained and well enough to do, with some adjustments for them. But it's also for them, if they have nothing to do, is also structure. Even for me, even for Dato, for you, and for the retired people, it's important to have structure. So we need to have plan. What am I going to do for the whole day? And that kind of brings us through.
So you're talking about structure. You're talking about not retire from something, but retire into something. So there's some salient advice for you from our two experts joining us on today's edition of Medical Today. Don't forget to send us or log into ask@medicaltoday.com and receive one of these bottles for free, courtesy of Pharmaniaga. On that note, I'm Gerard Ratnam signing off. We'd like to thank our doctors. Thank you very much for joining us right here on Medical Today. You have a great day ahead. We'll see you next week with more on Medical Today, Pharmaniaga News Channel.
我很荣幸能趁三亚阿莫拉这个那么好的机会，就到全马各地旅游，我还能了解各州的文化。我们一起来开始我们的旅程吧。
The Nation, a talk show from the current affairs desk with in-depth conversations on health, women, property, culture and performing arts. Only on the Nama News Channel.
Listen to views of industry captains. Analyze and examine trends and projections. Gain market insights from subject matter experts. Biz Talk every Friday only on BNC.
Tahukah anda apa yang sebenarnya berlaku kepada isi setelefon bimbit anda? Membuangnya ke dalam bakul sampah akan hanya mengakibatkan tapak pelupusan menjadi sesak. Tahukah anda lebih 42 juta isi setelefon bimbit tidak dilupuskan dengan cara yang betul? Dan jumlah ini akan terus meningkat. Ini berpotensi menyebabkan bahan toksik kimia teresap ke dalam tanah. Secara perlahan-lahan, alam sekitar akan tercemar sekaligus menimbulkan pelbagai masalah kesihatan kepada manusia. Tahukah anda bahawa 90% daripada bahan-bahan yang digunakan untuk membuat telefon bimbit boleh dikita semula? Ianya boleh diguna semula untuk menghasilkan apa sahaja termasuk barangan elektrik. Berita baiknya ialah MCMC telah mengambil inisiatif memperkenalkan kempen e-sisa telefon bimbit atau mobile e-waste. MCMC bersama syarikat-syarikat telekomunikasi menubuhkan pusat pengumpulan di cawangan yang mengambil bahagian untuk orang ramai melupuskan e-sisa telefon bimbit mereka. Dengan 72 cawangan di seluruh negara termasuk TM, U-Mobile, Maxis, Digi, Celcom dan Altel, anda boleh melupuskan e-sisa telefon bimbit dengan mudah dan pada bila-bila masa. Sertai kami untuk mencapai kempen 1 juta kita semula e-sisa telefon bimbit. Lakukanlah perubahan untuk kebaikan dunia, alam sekitar dan masa depan. Untuk maklumat lanjut, layari mobileewaste.mcmc.gov.my. Inisiatif ini dibawakan kepada anda oleh Industri Komunikasi Malaysia bersama MCMC.
Brings you the latest in current affairs, lifestyle and entertainment, as well as one-on-one discussions with fascinating personalities. Only on Nama News Channel.